Despite the high numbers recorded today, there is some good news from actual experts. According to Deakin University's Chair in Epidemiology, Catherine Bennett, and she joins me now. Catherine, thank you so very much for your time.
Hello.
Now, what is going to drive down these numbers and get us out of this cluster?
Well, there's three main things that control this. One is the lockdown measures we have in place, of course, and those severe restrictions. The other is that the test, trace, isolate is such a critical part as well. And the third important piece to the puzzle that we're now adding in at accelerating rates every day is vaccination coverage. And so the idea is, at the moment, we've been relying a lot on test, trace and isolate and that lockdown in particular to really reinforce all those measures in place to stop people mixing and to try and restrict those connections between networks, between households and workplaces. But at the end of the day, as our case numbers have kept climbing, they are controlled. We're looking at this reproduction number. The average number every person infects has been about 1.3. So every 10 people in one generation of spread, the next generation it's 13. That's compared to double or triple, 20 or 30 every 4 or 5 days if you didn't have this controlled. So this is a very controlled situation, but over time that builds up case numbers, and that's actually put the testing and the contact tracing under stress as the numbers get higher. So we're at a critical point here where the vaccination rates, hearing how they're accelerating is fantastic, because that's going to help to come into the mix more and help control that reproduction number and hopefully turn this around before the case numbers get higher, because that just keeps stressing your testing in other systems.
Yeah. Look, I did year 12 human biology, so I'm in no any way, shape or form an expert, but I've just got a question for you in terms of vaccinated people. What is the research or the writings that you have seen in regards to vaccinated people that do contract the virus? Is their viral load lower for when they pass it on, or are unvaccinated people of a higher viral load?
Well, what we've heard is a few things. Recent data out of the UK, really good data, because this is real world data, but they're screening people, actively screening them in the population, so they're not just waiting for people to come forward with symptoms. Gives you a better read on what's going on. The people who are fully vaccinated have a third of the likelihood of being infected as someone unvaccinated, and people even with one dose are somewhere in between, so they sit about a third lower than unvaccinated. So your risk of being infected is lower. What they've found, though, is with Delta, because it's so infectious, that when they compared people who were vaccinated to those not vaccinated, in the early days of their infection, they found that they have a similar viral load. So your chance of passing it on is probably very similar. But what they found is people who are vaccinated seem to have a shorter infectious period. So overall, they're still less likely to infect other people. But at the time when you're at your most infectious, there might not be a lot of difference. So that's why we do have to be careful about that still.
Yeah, of course. Given what we've seen in the ACT and how a large number of kids are now being infected, what's your view on vaccinating children under 16 or even under 12 against COVID?
Well, we have to wait on the trial data for under 12s, because that's not in yet to look at both effectiveness and safety. It is a worry to see more kids involved. This is something where they're reporting it overseas. They're seeing more symptomatic illness in children, and we've certainly seen here how quickly the whole outbreak accelerates once the virus is in a school setting. So that is a concern. It's always been on the vaccination rollout strategy, subject to the vaccines actually being approved in Australia. So it is something we'll be looking at. We'll get a better idea once we get the adults to those targets and see how that does translate to controlling the virus in the community. We now have obviously both Sydney and Melbourne who'll be working really hard to keep numbers or get numbers down to manageable levels that could then take us into the future with a good level of control. But then we have to understand how having a lot of unvaccinated children together in a school works. How do we keep the virus out of the school? If it does get into a school, does that mean it has to close down? And there are the other things you have to take into account, how vaccination can actually reduce risk of transmission as well as risk to the individual, even children, and that might become more important to give certainty to schooling and stop some of the disruption as well.
Yeah. Right. Now, the alleged adults, apparently the ones that are attending National Cabinet, none of them can really get on a unity ticket when it comes to agreeing onto the Delta model 4-phase plan to get us out of here. I'm sorry to put you in a position of an epidemiologist being asked political questions, but I think that you can probably have more clarity on this situation than most. How do we all get on the same page as a federation again and get the hell out of here?
Well, I think if we were trying to go from, zero and say, when do we open the gates? When do we allow the virus in? Do we keep the virus out and keep going for COVID zero? We'd be in a different place. I think now what's very clear, whether you're looking at Sydney, ACT, New Zealand or Melbourne, that we're in a different world. We now know that you can't hold this Delta variant back at the border, and particularly this variant that's circulating through New South Wales, Victoria, and now New Zealand and ACT. Just seems to have the edge even on some of the other Delta variants we've seen here. The Queensland one and the earlier Victorian one didn't take off in the same way. So that's the worry, that you're not going to be in a situation where you can keep the virus out completely, and then hopefully we will be forming a consensus about what it looks like going ahead, how you do manage low levels in the community with your test, trace and isolate, making sure we don't have pockets in the community where you've got a lot of people vulnerable, because vaccination rates are low there. That's the worry, because you could still have these outbreaks and people, suffering from the serious illness that does come with this infection for too many of them. So that's what we need to negotiate. And I think we've now got a new starting position. New South Wales experience, and now across other states, forces that conversation about where to next, what are our thresholds to deal with this, what is the contact tracing and the testing programs we are going to put in place to manage this going ahead. So there'll be more modelling behind it, but also there's nothing as valuable as that real lived experience to know what is happening as we accelerate vaccination rates and what that allows us to achieve in New South Wales over the next few weeks. That's going to be critical to hopefully bring those conversations together and get everyone on that one page, as you say. That's the most important thing.
Indeed. Well, Chair of Epidemiology at Deakin University, Catherine Bennett, thank you so very much for your time and your clarity.
Thanks, Sherry.